So the first topic that's coming from Sweden, it's a very, very interesting study that talks about coffee and multiple sclerosis. What exactly is multiple sclerosis? Is a neurologic disease where you would lose some of these isolation sheath around your nerves called myelin. Somehow through autoimmune disease or inflammatory process, that isolation sheath kind of wears off. It's almost like an electrical cable where electricity is not going to get through. The central nervous system is not going to be able to send a pulse. So patients with multiple sclerosis, they have muscle spasms, they have fatigue, they have blurry visions, they have some contraction and spasm that's going to paralyze them. And it seems that this study that's coming from Sweden is actually quite helpful. The effect of coffee actually with MS. This got a lot of global news. They looked at about 1,600 patients who had MS, compared them to about 2,800 patients who had no MS and they were healthy. And what they found was that if you drink about listen to this, 3 to 4 cups of coffee a day, it actually can reduce the risk of MS. Now, I called a shot about like 4 years ago. When I said that, every medical doctor, especially every cardiologist came and they were on the attack. You want people to drink 3 to 4 cups of coffee a day? Are you nuts? It's going to cause anxiety. It can cause heart disease. It can cause all of this. But we'll see more and more of these studies coming in support of coffee. And believe me, it's not the caffeine itself. It's a lot of antioxidants and this chlorogenic acid that's in the coffee that reduces the inflammation, and it's helping us. MS obviously affects about 2.3 million people worldwide. It's a serious health problem, and we want people to know about this. And this was a big topic in the American Academy of Neurology in Washington, D.C. last week. So more and more studies from Johns Hopkins is coming in support of this. And actually, I was quite astonished that in the Journal of National Cancer Institute, they talk about coffee and the fact that it can reduce the risk of melanoma by 5-fold. Now, more and more studies is needed. A lot of these studies could be observational studies, but it seems that there's something in coffee that works like a drug and it can actually help you. Interestingly enough, there's another study that's coming from Korea about coffee. And in this time, it's what I like about this, it can actually reduces the risk of heart disease, which is completely against anything that we believe on. But it's a good study because they are looking at about 25,000 people. And what they're seeing is they're using the CAT scan, calcium score test, to see what is the level of calcium in your coronary arteries, the vessels that are bringing the blood flow to your heart. If you drink a lot, is it going to reduce it or not? And again, 3 to 4 cups of coffee seems to be reducing the amount of calcium and calcium plaques in your coronary artery. So again, once again, I win. I was right about coffee. Now, there's a disclosure with this. If you have anxiety disorder, if you have reflux, if you're pregnant, I don't want you to drink 3-4 cups of coffee. And the deal is that you're going to not have a lot of sugar and milk with this. If you like black coffee, I think there's a lot of antioxidant that comes with this. We're listening to World Health News. My name is Dr. David Samadi. I'm the chair of urology at Lenox Hill Hospital.